You know, millions of people every year deal with heart disease around the world. And here locally, you know, you wonder if you have an issue with heart disease or a loved one, who do you turn to when it comes to getting surgery? Well, we've come over here today to Ocean Springs Medical Center, part of Singing River Health System, to talk to Dr. Jason Williams, who is a cardiovascular surgeon for Singing River Health System. How are you, sir?
I'm doing great. Thanks for having me.
Well, thank you very much for being on the show. If you would, let's start out and talk about your background and your credentials.
So I started off my medical career in college. I went to the Air Force Academy, and then from there went to medical school at Harvard Medical School in Boston. Trained in general surgery for 7 years at Johns Hopkins University up in Baltimore, and then did a 3-year fellowship in cardiothoracic surgical training at Duke University Medical Center. After that, I spent some time out in California at an Air Force base, and then have been fortunate enough to be here for about the last 2.5 years.
Well, first of all, thank you for your service.
Thanks.
Appreciate that. My father was Air Force. What brought you here to the coast?
It was an opportunity that I really felt like I couldn't pass up. There was an opportunity to come to a local community, which is closer to home. I'm originally from Georgia, so bringing the family back closer to the grandparents was a big draw for us. And
Bulldog fan?
Oh, huge Bulldog fan.
Well,
yeah.
we won't hold that against you.
We had a pretty good day yesterday on the recruiting trail, so we're...
I'm talking Georgia Bulldogs.
Yes, absolutely.
Okay, I just want to... we don't say Mississippi State because that's
Bulldogs
my team.
here in Mississippi. That's right.
So let's talk about the program here. You know, cardiovascular program. You know, as a surgeon, tell us about the program here.
Well, I think the important thing to remember for anyone, patient, family member, or whatever, is that word you just used, which is program. This hospital system has done a terrific job of developing our heart care model as a program which involves multiple specialties that really focus on the individual patient. We have a tremendous group of cardiologists here that have exceptional skills with regards to the things that are done in the cath lab and the way that they manage patients medically, so that those patients can potentially avoid major problems down the line. We have also established a way for the entire heart team to come together and treat a patient who potentially has a surgical issue, where the cardiologists and the surgeons get together, and sometimes we'll bring the anesthesiologist involved as well, or other specialties that are required. And we look at the individual patient, the individual patient's needs and issues, and then we individualize their treatment. And being able to do that as a team is very, very important. And when I say team, that doesn't just mean the doctors. So one of the things that I like about this system, more than any system that I've ever worked in, is that the support staff, the ancillary staff, the nursing staff that we have here, therapists, mid-level providers such as physician's assistants, nurse practitioners, some of the finest in the country that I've ever worked with. And when we have that kind of support for the physicians that are taking care of patients, the patient's outcomes are just bound to be good. We're good because everyone at Singing River Health System is good, and that's one of the reasons I love working here. Well,
you know, that's one thing that I have found in a lot of the segments that we do, that I've done with Singing River Health System in so many different areas, is the teamwork.
Right.
That everyone, you know, works together. As you said, you know, not only the surgeons, but those on the surgical teams, the nurses, the anesthesiologists and everything, on how closely you work. So, and again, as you said, I think that's one of the key things is each patient is different.
Right.
And I mean, it's not a cookie cutter kind of thing. So you've got to really sit in there and decide as a team. And that's what makes you number one.
I think so. I mean, I think we have a terrific setup here, and a terrific model for the way that we manage our patients, and it works out very well. We're able to do very complex stuff on very difficult patients, and we're able to get them through back to a healthy lifestyle, where they're vibrant, active members of our community, which is really the important thing.
Right. So why should a patient choose you? I mean, besides some of those reasons, why should they choose Singing River Health System?
Well, I think those are the most important reasons. You're going to get top-level care from the latest and greatest cutting-edge things that can be done in cardiac care. But you're going to get it
post-surgical too.
Preoperative and post-operative.
Right.
But you're going to get it in a community hospital with people taking care of you who really care about your outcome. And I think that that's really the key to this facility. The other thing that we are able to do here is we're able to provide some very top-level, kind of latest and greatest technological advances.
That was going to be my next question. Talk about some of the technology that you're using here nowadays.
Right. So the first thing that we started doing a couple of years ago was we started implanting sutureless valves. That gives us the ability to do heart operations a lot quicker. It helps patients recover faster and get out of the hospital and back to their lives quicker. It also helps us take care of them down the line, makes things easier 10, 20 years from now. We have developed an advanced treatment strategy for heart failure. And patients come in and the cardiologist can initially help to manage them, and sometimes those patients need more support than simple medicines can provide. We have a program here with an Impella device, which is a left ventricular assist device, which can take patients who are very critically ill and support them through that process and get them back to their life again. That's not something that's done in many places throughout the country, let alone throughout the Gulf Coast, and we have that ability to do that here. We are providing a transcatheter valve program as well as transcatheter mitral valve program, so we can treat your aortic and mitral valve diseases in the cath lab or the hybrid operating room suite here as well. And so all of those things, I think, allow the people of the Gulf Coast in our area the ability to achieve excellent outcomes with the latest technology in a community setting where they really feel like they're cared for on an individual, personal basis.
And that's one of the major things there is, each one feeling that they're, you're here for me.
Exactly right. This isn't a factory. We don't have a factory.
Assembly line.
Exactly right. We care about.
I've been in some of your operating rooms around here, so I've seen the latest technologies and everything, and I'm just, in awe of how far technology has come, and and hats off to Singing River Health System for including all that technology, and providing it for the surgeon. So, Dr. Williams, thank you so much.
Thank you.
Very informative.
It was a pleasure.
If you'd like some more information about that, of course, you can find it online, or if you're having some heart issues, get with your general practitioner, get them to refer you.